Hello and welcome to this week's What Were They Thinking? We have a number of news items this week. Most of them relate to the CCP virus and the unexpected consequences of the new variant. Notably the impact it's having upon the healthcare system in many countries, but also the age group that's been notably affected by this outbreak in particular. The various evidence of different treatments and how the pool of early discoveries is getting drier each day as different studies are withdrawn, countered, or proven to be unreliable. Then there is the even newer variant of the CCP virus, the Lamda variant, which has now shown up in 29 countries. In more positive news, there's the researchers who found a way to link a paralyzed man's brain to a speech machine and thereby allow him to communicate, and the possibility that the Hubble telescope may yet be recovered. The timestamp for each of these and others can be found in the description box below. Let's start with the CCP virus, and notably the current cohort of patients who are being infected. At least according to anecdotal evidence from one doctor in the United Kingdom, the number of patients being affected this time is increasing in about the same way as last time. That in and of itself isn't great, but not the worst news imaginable. A sudden increase compared to last time would be a problem. What is worrying is that the patients this time are younger and younger. Where last time you could have anyone between 27 and 82 needing critical support, whether that's respiration, constant monitoring, and more, they were all generally in a very wide bracket. This time, it's people between their 30s, 40s, and 50s. That's a worry. Even more worrying than that figure is that many of them are either unvaccinated or only partially vaccinated, only receiving the first dose of a vaccine. This process has, at least in the minds of the doctors involved, been an indicator that this time the surge won't be as bad, but it will last for a much longer period. This means they're likely to get similar numbers, but over a longer time frame. And given the age that we've mentioned, they're likely to have impacts that are more undesirable if the implications of CCP virus drag out after treatment occurs. These are people who are in a prime working age, likely in fairly senior positions relative to younger individuals, and as a result, they are the ones who are generating the capital that the countries need to run these hospitals. All the wards that are currently being converted back into general purpose wards will need to be returned to COVID wards. Those same hospitals that are currently running many, if not more, elective surgeries than prior will now also have to slow down the provision of those services, as the resources needed to facilitate those will instead need to be dedicated to the CCP virus. The problem is further complicated by staffing shortages. Most countries have been dealing with the issue of the CCP virus for more than a year. This means that staff have moved between having to deal with other staff being possibly exposed or infected by the virus, they themselves either being possibly exposed or infected, or having to deal with ramifications from social measures used to limit the spread of the virus. Things like lockdowns. This means that over a year, everybody has become worn out and exhausted. It leaves most medical services in most countries increasingly short-staffed and with staff who simply lack the resilience required to keep pushing through. Going to the other side of the Atlantic Ocean, and now America, a similar issue is being seen relating to the issues around vaccination. The majority of people being hospitalized in California notably are those who have not received all of the vaccination shots necessary for full protection. That is, the majority of individuals who are winding up in a hospital are either partially or not at all vaccinated. In fact, some deny that the vaccine is necessary at all, with their theory being the CCP virus is all a scam. These individuals are perhaps why we should bring back natural selection. At least one set of claim statistics says that 99.8% of deaths, 99.9% of hospitalizations, and 99.1% of the cases that were diagnosed were related to those two categories, partially or not at all vaccinated. The partially vaccinated cohort is also another worry. There are more than 140,000 people in San Diego alone who are overdue for their second dose of a vaccine. That's 140,000 people who are still vulnerable. Interestingly, unlike the UK, in California, the largest group of people who are being diagnosed with the CCP virus is between 20 and 39. This is a similar number and overlaps with the UK data. That would indicate that the Delta variant is a worry. While there are a number of people who are getting at a younger age, it appears vaccinations are the most common factor. In fact, vaccination rates are incredibly low, and most patients who wind up in hospital, who don't deny the existence of the CCP virus, to some degree regret not having received the vaccine when it was available before being infected. In America, it's notable that Arkansas has one of the lowest vaccination rates in the country. That is about less than 35% of adults have been vaccinated. This is 35% in a country that has vaccines available to just about everyone at this stage. Yet, their admission rate for adults to hospital with the CCP virus almost entirely consists of people who have not been vaccinated. It simply makes no sense. Even the CDC is weighing in on this and saying that it's very simple. Low vaccination regions have significant increase in hospitalizations, and the two are directly related. Unfortunately, that correlation is entirely negative. Lower vaccination rates, the higher the incidence of admission. The higher the vaccination rates, the lower the incidence of admission. What we remain surprised by is that people are confused that the CCP virus really exists and it really has made them extremely ill. The rationale behind that is absolutely mind-boggling. Nobody in America could keep the president's indiscretions about fellatio quiet, and yet somehow they believe that the global conspiracy to create a fake disease and spread news about it is possible. America, of all countries, should be the most critical in evaluating that particular claim. Going now from the handling of the current variants that are of most concern to the possible next variant of most concern, the Lamda variant. As we've already mentioned, this has been found in 29 countries to date. In the most affected country so far, Peru, 596 have died from it, and that's twice what Hungary had at 307, both of these being per 100,000 population, mind you. So we're talking standardized figures here that will vary slightly by country. One of the reasons Peru has fared poorly is that, relative to other countries, their healthcare service is rather poorly funded and certainly wasn't prepared for the outbreak the way that's been seen now. Unlike the Delta variant, which seemed to show up relatively quickly and spread very quickly, the Lambda variant is slightly different. It was first noted in August 2020, and by June 2021, it was considered a global variant of interest by the World Health Organization, and other countries followed within a week. That means in under a week, most countries in the world had accepted that this particular variant should be tracked and followed very carefully. Like some of the other variants, such as the Delta variant, the Lambda variant has notable mutations in the spike protein. These are what allow it to bind to the ACE2 receptors and invade the body. Essentially, having a better developed spike protein allows for the virus to better infect cells. That's the necessary step in order for the virus to replicate and continue to infect both more cells and more individuals. The secondary benefit to this spike protein is that, by virtue of its similarity to naturally occurring things in the human body, it provides a degree of protection from antibodies. It essentially acts as a do not interfere sign. The implications of this are similar to what we see with the Delta variant, notably that it has a reducing effect on the efficacy of vaccines, but also in this instance it appears to be somewhat more infectious. Thankfully, whilst it has been overshadowed by the Delta variant, it has been overshadowed for good reason. It isn't as infectious. This means we're likely to see fewer instances of this infecting people relative to the Delta variant. What would be a worry is the next case study we have for you. This case study, unfortunately, is still on the CCP virus, but specifically, and interestingly, a 90-year-old Belgian woman who was diagnosed with 2 different variants of the CCP virus at the same time. These were, thankfully, not the most worrying strains. Rather, it was the UK and South African variant. Still, not a good sign, but not the worst possible news. We've previously mentioned that there was possibility for this to occur, and that if it did occur, it could theoretically lead to crossover in the genes between these 2 variants, creating a third, more disturbing variant. In this case, the report states very clearly that the 90-year-old woman was not vaccinated. She got sick in March and was treated. There are now a number of questions about not just how she became infected, but how she was exposed to the 2 different variants in question. It likely would have required exposure to 2 different individuals, each carrying the different strain, and that would have allowed them to enter the same host. Going to a slight throwback now, at the start of the outbreak, there were all manner of treatments that were touted as effective ways to resolve the CCP virus. Hydroxychloroquine was one that received some of the most attention. Another was ivermectin. Ivermectin was at the time criticized quite harshly by us. We stated very clearly that it's unlikely that a drug intended to treat parasites in the manner that it would have been effective against a virus. It's the same way taking antibiotics for a viral infection doesn't help. Despite this, it was worth at least looking into. There is always capacity for crossover in what something can treat, however slim the chance may be. This led to interest by various research groups and various publications. Some claimed more extreme outcomes than others. One of these was notably said to be a randomized controlled trial, and that it used the medication and found that it was effective as an intervention to the CCP virus. In fact, they claimed up to a 90% reduction in mortality. That kind of claim is practically miraculous. As always though, miraculous claims require miraculous evidence. That miraculous evidence is now in question as the paper has been withdrawn. The reason given at this stage is ethical concerns. Ethical concerns is the nice way of saying that someone pointed out that, at least in the first introductory section, there was a lot of plagiarism. In fact, there were a lot of other issues as well. The raw data did not match with the conclusions drawn. The claimed age of participants was not correctly matched with what was said to be the cohort. That the numbers claimed as treatment groups and non-treated groups weren't lining up. You might be surprised to learn that the person who identified this was a master's student. So we're not even talking about someone who is highly skilled and familiar with the topic area. Fortunately, they had the good idea to send this on to people who are much better at identifying it. They in particular sent it on to 2 researchers who are much better equipped to deal with this. Those researchers noted even further issues. Patient records were copies. that there are many other problems, and that collectively, none of these can be attributed to an error on the part of the researchers. It appears to be more than just ethical concerns. The problem with this kind of article not just being withdrawn, but the existence of it, is that it has given rise to other studies. Notably another study in the UK that was looking at combining COVID-19 and ivermectin treatments to prevent people from getting to the hospital in the first place. This is drawing off resources that could be used to follow up on research that has value, rather than research which is stimulated by what is effectively the largest study of ivermectin and CCP virus without any value. It's often touted as proof by people that the value of it is significant. There was this large study, it showed benefit, therefore there's peer-reviewed evidence. Yes, and unfortunately now the other end of the peer review pipeline is coming into play, where your peers look at what you've published and investigate the shenanigans you managed to slip by the editor. Because this study has been so large, it's also been central to larger scale analyses, notably meta-analyses. When you remove this study, being what appears to be outright fraud, the conclusions that are reached within those meta-analyses no longer hold merit, and in fact, quite often it reverses the finality of it. That is, where once they may have said there is reason to pursue this, they now state that based on the lack of evidence that's for ivermectin, there is no reason to continue researching along this line of reasoning. Moving now away from the CCP virus and to something that's interesting but nowhere near as controversial. A fabric has been developed which helps to passively cool the human body. Given the various countries at the moment that are experiencing heat waves, this could be particularly useful. It may also find its way into building developments, applications in aged care facilities, and in deployment in areas where heat is a concern and you might not have ready access to other ways of keeping cool. Similar to how a space blanket is used to keep warm, this may bring your body temperature down. The material is called a metafabric, and the metafabric is described as something that exhibits efficient radiative cooling performance and provides breathability and comfort for wearing. It achieves some of this cooling effect by the way it's been made using titanium oxide polylactic acid composite nanoparticles. These, for all of their fancy language, can be summarily described as reflecting most of the light, that is both visible light and those in the mid-infrared and ultraviolet ranges. Tests of this, both in a stationary situation and compared to other fabrics, and in use on a stationary person, both demonstrate significant differences from the other fabric options. Temperature differences of anywhere up to 10 degrees Celsius. This is great in theory, but you then need to place in the context of what it would be used for. Let's say it's being used as actual clothing. The problem you now face is not only are people moving, which is going to significantly affect the way the material is exposed to the light, but it's also going to affect how much heat is being generated by the person themselves and how that's going to be disposed of. There are also questions about what implications things like dye would have on its feasibility as a product. Will it only be available in the current appearance, or will they be able to add colorations to it and thereby add what you could summarily describe as fashion sense to it? Going now from technology and material science to biology, and notably sex. Sex among algae. These are the strange green blobby things that turn water all manner of colours and make pond scum exist. Algae are one of the oldest life forms on Earth. They are also one of the biggest oxygen producers on the planet. What is interesting about this discovery by Japanese researchers is that there is a particular subset of them that have 3 sexes. Unlike humans, where you have males and females, this is a situation in which you have 3. a male, a female, and a third sex that they have rather unimaginably called bisexual. For a time there, we thought with Japan's fascination with anime and all things tentacle, they might have called it a furry. So many missed opportunities. The evolutionary drive to develop 3 different sexes among algae is interesting, mostly because it's not necessary. Algae can reproduce asexually, although admittedly this does only create a clone of themselves. They can also reproduce sexually, and depending on what happens, it will create different numbers of chromosomes, or more accurately different sets of chromosomes. There are also notable examples in the algae family of hermaphrodism, and that is where the algae can change its sex based on gene expression. Moving on to interesting news on communication. And this is the article you mentioned early on about a paralyzed man who's now able to communicate through text-to-speech. For the most part, that's not a novel concept. What is novel is that they've used the man's brainwaves to create the text, which is then converted into speech. The way the device works, in the simplest of descriptions, is that there's a limited dictionary of words, about 50 of them. Things like water, family, and good. This is linked up to a device that's implanted into his brain. It's a very, very delicate electrode that sits over his speech motor cortex, the part of the brain that will control your tongue, jaws, and throat muscles. The team was then able to get an AI to learn how he would activate the motor cortex for speech in response to those particular words. They could then associate the signal from the electrode in his brain with these words, and the machine would then say them. Admittedly, it is still quite stilted and slow, at about 18 words per minute, and only 75% accuracy. Nonetheless, 75% accuracy and 18 words per minute is far more than was said before. Next is astronomical news, and a throwback to the Hubble telescope. We've mentioned in recent weeks how the telescope deployed in 1990 has well and truly gone past its use-by date. It's begun to break down, and the technology that was used is, at best, hard to replace, and in other cases, not possible to be replaced. Since June 13th, it's been playing up, and more accurately, they've been unable to make it work at all. Diagnostic tests and analysing what came back has indicated that they might know what's happening, although NASA's not entirely sure that their solution will work. NASA's going to try and swap out the payload computer. The payload computer is a piece of machinery from the 1980s. Yeah, that's how old the technology in Hubble really is, and they're going to try and swap out from one backup to another. In order to do this, NASA has to switch over the entire telescope from its current system to the backup. And the important part they're trying to fix here is known as the Science Instrument Command and Data Handling Unit. That in and of itself is not too bad. The problem will be what happens if that fails. There are only 2 units on the telescope. The backup now is their only option, and if it fails, there are no more options, and Hubble will be dead. The final news we have for you this week is largely just an interesting observation study more than anything in particular. It's about learning new languages and how best to learn them. Most people will use a app or program like, say, Duolingo, Rosetta, or similar. All of these are based on a digital device, and that makes them incredibly accessible and convenient. However, it would appear that writing out your lessons by hand is still better than trying to learn in a digital format. The study involved 42 adults who were trying to learn the Arabic alphabet. They had no knowledge of it, and so some were split into writing it on paper, some were to type it, and some watched videos learning what it was and how to use it. When you look at the different cohorts, those who were writing it out learnt the best. And this has implications for learning in general, notably those who are in schools. Schools at the moment being very largely driven by online learning and teaching. The writing group had the best performance when it came to naming the letters, writing them, spelling words, and reading. This information could be useful both in learning another language, but also finding ways to develop your own learning skills, and notably how best to reinforce and consolidate what you have learned. Having written it out by hand appears to have benefits that aren't directly related to penmanship and your ability to write, but also the way your brain incorporates this information. That's all the news we have for you this week. Thank you for watching. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.